Hi, I'm Tori Evans. I'm going to be talking about Hodgkin's lymphoma today. What is lymphoma? It is a type of blood cancer that will occur when T or B lymphocytes divide faster than normal cells, or they will live longer than they are supposed to in the body. It can develop in the lymph nodes, which are located throughout the body and generally are in clusters. They are also found in bone marrow, spleen, the blood, and among many other organs and areas in the body. When it spreads, it does create tumors. Some of them are visible, others are hard to identify unless you have a scan or some kind of visual that is used. What is Hodgkin's lymphoma? Well, there's two types of it. One is Hodgkin's lymphoma, aka Hodgkin's disease, and then there is non-Hodgkin's lymphoma. It is a type of cancer that originates from white blood cells, which are called lymphocytes, and those are throughout the lymphatic system in the body. The lymphatic system is a network of nodes connected by vessels that drain fluid along with waste products from the body. What the lymphatic system is basically it's one of the main functions of the body, and it deals with the immune system. So if you have a very poor immune system, Hodgkin's lymphoma can develop easily, but not all the time. It is composed of a bunch of tiny thin channels that consist of lymph nodes and some organs such as the spleen and thymus. They are generally located all over the body, and some of the areas would be the cervical, the axillary, and the groin, as shown in the pictures to the right. Who can develop it? Well, there's a bunch of different ranges that it can develop in. The most common ones are from adolescents from ages 10 to 21 years of age. There's young adults, which are 21 to 35 years of age, and then you got older adults, 50 years of age or older. It is a bunch of room to where it can develop, but it's not likely all the time to be developing. Now, how can one develop it? There is no true one reason to how someone can develop Hodgkin's, but there are some risk factors that can play a role in it, such as, like I stated earlier, a very poor immune system. If you had the Epstein-Barr virus that causes mono, and which has been seen in 20 to 80% of the Hodgkin lymphoma tumors. If you are a same-sex sibling and an identical twin, those are at higher risk. Lack of exposure to bacterial and viral infections at early age can also play a role. Although some say that it can be hereditary, especially if one family member has it and then another one gets it somehow. They seem to link it to hereditary, but after doing a lot of research and tests and stuff, they're saying that it isn't hereditary, and there is a possibility that a family member has had it, and then there's a possibility that another one is at risk to develop it as well. Some of the organs, cells, and tissues that are affected by it would be the lymphoid tissues, the spleen, the adenoids, the thymus, the tonsils, and the digestive tract. As you may not know where they're located, but when looking at the picture to the right, it shows what all is part of it that can get affected. I only listed a few. Some of the signs and symptoms of Hodgkin's would be painless swelling of the lymph nodes in the neck, chest, underarm, and or groin, fever for no known reason, weight loss for no known reason, night sweats, anorexia, itchy skin, fatigue, pain in lymph nodes after drinking alcohol. If you are experiencing any of those, you might want to check a doctor and see what they say, but sometimes it's not generally linked to it. Some of the treatments that you may find with Hodgkin's lymphoma patients would be chemotherapy, radiation, or a combination of chemo and radiation, which is most common. Chemotherapy destroys cancer cells in the body so they can't redevelop. It eases cancer symptoms and controls the cancer cells from spreading any further. Some of the side effects associated with chemotherapy are nausea and vomiting, hair loss, anemia, infertility, taste and smell changes. Something may not taste or smell good like it used to you, and you'll develop a different diet, along with many others. And then you have radiation therapy, which is only used mainly for treating cancer by using high doses to kill cancer cells in the body. Some of the side effects from that would be, early side effects would be nausea, fatigue, hair loss, and skin problems. And then you have late side effects, which would be lung and or heart issues, which may take years to develop, but you can still get them. But once they do develop, they are permanent. Some of the preventions that you can do to help protect yourself from developing Hodgkin's, some of the main things that people don't realize is not knowing what the causes are, and which makes it difficult to try and prevent it from developing. But some of the preventions that you can do are exercise or physical activities, environmental exposure, changing your diet or nutrition, most likely healthier, viral bacterial sources, secondary cancer or survivorship. Some of the consequences that arise with it, there's two kinds, and they're short-term and long-term. Short-term consequences are ones that involve a relatively short period of time, such as hair loss or nausea, increased infection risk. But long-term are more of a longer period or sometimes permanent. And those include heart, thyroid, or kidney damage, reproductive problems, and development of another cancer later in life. You may develop another one, or you may not. It just depends how your body is. And my references, so basically it is good to know the outcomes and know what to look for when you may have cancer, but not all the time will you have it. There's many symptoms for a lot of things that are similar, but you just got to be careful and make sure not to over exaggerate or scare yourself. But I hope you learned something, and I know I've been learning a lot doing research on this. So thank you. Hope you enjoyed.